If you make a mistake at work, could someone die as a result? Well, if a doctor makes one, it could cost someone their lives. So it's crucial they receive quality education and training. The skills and experience residents gain during their 3 years of medical residency prepares them to deliver high-quality care their patients can trust. I've been a nurse in a residency program for the past 9 years, and I've had the privilege of participating in the education of over 50 exceptional doctors. I'll discuss 3 main points. What exactly is a resident? How does a medical residency program work, and what do residents do? So let's begin by exactly what a resident is. A resident is a person who has received a medical degree, either an MD or a DO, and they practice medicine under the supervision of fully licensed physicians, either in a hospital or in a clinical setting. Residents are commonly referred to by the letters PGY, which stands for postgraduate year, so their PGY is 1, 2, or 3. So a PGY 3 is a resident who is in his 3rd year of residency. PGY 1 is a resident in his 1st year of residency. PGY 1s are also referred to as interns. All of them, PGY 1s, 2s, and 3s, are doctors. They've all graduated from medical school, so it is appropriate and correct to refer to them as doctor. They have earned it. So now that you know what a resident is, let's talk about how a medical residency program works. Residents learn through a combination of sources. They learn through didactics and curriculum. Didactics are lectures. Lectures are given by guest speakers, faculty, other residents and students. And the curriculum it's a structured guide, sort of like a syllabus. It maps out required competencies that the residents must meet in order to graduate, and they're tested on those throughout the 3 years they're here. Inpatient hospital. They have what's called Family Medical Teaching Service, where they take care of patients that are hospitalized, either through the emergency room or they're admitted from a physician's office visit. Pediatrics, usually at Children's Medical Center or Cook's in Fort Worth, the emergency room, and they care for ICU patients. In the outpatient or clinical setting, they do rotations with specialists, and there's many of them you'll see on the slide, like gynecology, orthopedics, cardiology, surgery. The Family Medical Clinic, which is where I work, they see patients in a clinic just like you see your regular primary care physician. They have patients that they're responsible for on a regular basis. Whatever year they're in determines the number of days a week they're in clinic and how many patients they're required to see in that year in order for them to graduate. So now that you know what a residency program is, let's talk about what a resident does while they're in it. They do assessments, both inpatient and outpatient. They learn to collect a detailed personal and a family medical history, and they perform comprehensive head-to-toe exams. They look for signs of chronic diseases, and they address specific complaints or problems the patient has within. They formulate assessments and write concise treatment plans for the patients and their family members to follow, but for other members of the medical team to follow also. They do procedures. They do inpatient procedures like deliver babies, intubations, put in central lines. They run codes, so if you're in the hospital and you hear a code blue call, it's the residents that are running it. Outpatient, they do joint injections, remove toenails, put in IUDs, take them back out. Suture lacerations, they do dermatological procedures like take off moles, warts, skin cancers, things like that. And they also do colposcopies here, which is if a woman has had an abnormal pap smear, they go in and take a little biopsy out of the cervix and send it off to see if they need to proceed on with more specific testing, like it might be cancerous. During their 3rd year, research projects are done by the third-year residents. Research projects teach them how research is conducted, how it's evaluated, how it's explained to patients, and how it's applied to patient care in their practices when they're out on their own. They also learn statistics and learn how to interpret what the numbers mean. So I decided to talk about this because I often find myself explaining to patients and to nursing students that are working with me, my friends, when they find out where I work, I'm having to explain to them what a residency program is and what a resident is. So I thought other people might appreciate knowing what it takes to become a doctor also. These residents work hard. They make about $50,000 a year per year in the residency, and that sounds like a lot of money until you think about what they do to get it. These men and women spend 11 years refining their skills. They work 80 hours a week, 16-hour days for 3 years, and that averages out to about $12.50 an hour. In their journey through residency, they go from obtaining knowledge to applying it, and they become competent, independent, practicing physicians.